Yes, I'm Heather Barrington. I'm both a public research partner in research and patient public involvement coordinator at Comet, and I'm doing a PhD, obviously, and I'm going to be talking to you today about designing a study to explore how to make research invitations that interest and engage potential patient participants. So shortly after my son Max here, who's shown here, was diagnosed autistic, he took part in a clinical trial. I worked in health service improvement at the time, and the whole experience made me think about the trial and what might have made it better for him to take part in. Shortly after, I found out about patient involvement in research and decided to get involved as a parent in improving research for children. As part of this journey, I attended a meeting where I heard about the problems of outcomes in research. I heard that different studies in the same condition often measure different outcomes, meaning that the results of research studies can't be compared or combined. This means delays in finding the answers to crucial health research questions. I heard also that patients often weren't involved in deciding which outcomes are important to measure in research. The solution I heard was a core outcome set. What? I hadn't a clue what this was all about. Thankfully, a researcher next to me explained that this is simply an agreed set of outcomes for a particular condition, and that these outcomes should be measured in all future clinical trials in that condition. I learned that patients, clinicians, and other experts all get involved in agreeing what is core by completing surveys and attending meetings. The penny dropped. It's vital patients get involved. Fast forward 12 years. I've been patient and public involvement coordinator for Comet for 11 years. Comet's an international organisation driving forward research and practice in how core outcome sets are developed and used. Over the years, I've heard patients say how it's hard to get their head around what core outcome sets are and to understand precisely why patients should get involved. Patients often think this has been sorted out years ago. The opportunity presented to do a PhD. This was my chance to explore the challenge of patient participation in core outcome set studies. Reviewing core outcome set studies that had involved patients as participants, I found proof that recruitment is often conducted electronically and can be challenging. Wearing my patient hat, I'd seen written invitations into these studies. Some were inviting, others technical and disengaging, but I wanted to discover what makes a good research invitation from a wider patient perspective. I've collated invitations from recently conducted core outcome set studies, and we'll be taking these to a series of focus groups to explore what it is about a research invitation that engages and empowers a patient where others' invites might get thrown in the bin. After analysing this data, a consensus meeting will be held to develop guidance for future core outcome set developers on what makes a good research invitation. Ultimately, we hope our research will help ensure greater participation and diversity in core outcome set development, which in turn may make more research studies, which in turn may mean that more research studies measure outcomes that matter most to patients.